So, Dr. Pratt, what are the barriers that smokers with mental illness face in the United States?
So, in the United States, public health messages have been very effective at reducing smoking rates in the general population. However, smoking rates are still very high in among people who have serious mental illness. They're about 4 times as high as in the general population. And this is for many reasons, but one important reason is that in the mental health system itself, providers have actually rewarded people with cigarettes for positive behaviors. So if someone attends a therapy group, they get a cigarette as a reward. This doesn't happen very often anymore, but it happened historically a lot. And providers still today feel that smoking and the pleasure that people with serious mental illness get from smoking is something that we should not take away from them. So even though it's widely known that smoking is very harmful to health, and there are still many people in mental health who are providers who smoke themselves, who smoke with their patients and clients, and who believe that we should allow people with serious mental illness their last pleasure in life. So that it becomes a real barrier to helping people quit smoking. The other major barrier is that there is a belief that smoking and smoking cessation, that's for the medical community to take care of, not for mental health. So, we focus on depression, we focus on psychosis, we focus on psychiatric symptoms, but smoking cessation, that's a medical problem, and mental health, that's not our scope of practice. So that's the other major barrier.
And what benefits harm reduction approaches could bring to this specific population?
So people with serious mental illness, they really can quit smoking. There are many clinical trials showing that if you give people evidence-based cessation interventions like medication and therapy, people can quit. However, most people with serious mental illness are not ready to quit. At any given moment, they try and they try, but they cannot try 365 days a year, year after year. It's exhausting. So for the about 10% maybe are sort of ready to quit in the moment. The other 90%, they're just left to keep smoking. There's nothing for them. So they need harm reduction. They've tried to quit, they can't quit. We have to use harm reduction approaches. So in my center, we focus on trying to use vaping as a harm reduction strategy because we know that burning tobacco and creating smoke is much more harmful than heating a liquid containing nicotine that produces a vapor. So that particular harm reduction strategy could be really very effective in this population, especially because so many people, although they've tried to quit smoking, they really cannot quit and they need something else. They need an alternative that allows them to get nicotine in a more appealing way than a patch or gum or a lozenge. And this is a way to do it. So I think we can reduce a lot of harm using vapes for this population. Not for children, no children, no adolescents. We're not suggesting that people should start vaping if they are not already addicted to nicotine. But for people who are already addicted to nicotine, it's a very important harm reduction strategy.
And if we could see in the long distance what are the future perspective of harm reduction approaches or what we should do to have effective harm reduction approaches?
There unfortunately is still a lot of misunderstanding and misinformation about approaches like vaping. So when I go and talk about my work, whether I am talking to family member, friend, or fellow scientist colleague, many people still say, isn't vaping just as bad as smoking or maybe even worse? And it's not. The reality is it is not. And so what we need to do now is to get the word out that vaping is not healthy. Vaping is not something that we suggest people take up as a habit if they are not already addicted to nicotine. But if they are addicted to nicotine already, um, we need to encourage people to at least switch to vaping from smoking until they're ready to be completely nicotine free. At least being smoke free is better than continuing to smoke and getting smoke in your lungs. So this is the message I think we need to get, and we could save literally millions of lives.
Thank you so much, Sarah.
You're welcome.